Um, Hi there.
Okay, our audience is there. We're live.
All right. So, do we start? Should we give an intro or do we go right into it? I'm Chanie Fingerer. I am a registered nurse in the States. I've been working labor and delivery, postpartum, and newborn care for the past 7 years. And I am also the owner of Yoledet Academy Instagram account, and recently launched my podcast, the Happy Birthway Podcast. That's all about prenatal, perinatal education and birth stories. And I'm really excited to be here.
And I'm Dr. Deena Zimmerman, who's a pediatrician, a lactation consultant, and also a Yoetzet Halacha.
All right, so I will start. The more science progresses, the more we know of the benefits of breastfeeding for both mother and baby. So the more we know in science, the more it informs us of how halacha is interpreted. So what we do know now about the benefits of breastfeeding is to baby, it decreases the risk of SIDS, it protects against respiratory and gastrointestinal diseases, it reduces ear infections, it lessens the likelihood of type 1 diabetes, it decreases risk of childhood cancer. It protects against allergies. Those are some of the benefits to baby. Whereas the benefits to mom, it lowers her risk of osteoporosis. It reduces her risk of breast, uterine, endometrial, and ovarian cancer. It decreases the insulin use for breastfeeding mother with diabetes. And overall, it decreases the incidence of heart attack, stroke, and diabetes. It also, in the immediate postpartum period, helps with making sure that the uterus is contracting strongly, which can thereby reduce the risk for postpartum hemorrhage. And it also decreases the risk of anemia and infection. So, Dr. Zimmerman, can you tell us how the science affects halacha here?
Okay, so one of the underlying principles in halacha is the importance of preservations of one's health. Okay, we have a halachic principle in terms of how we have to do things to protect ourselves. It's called din ma'akeh. Okay, we learn from the rule in the Torah that if you build a house, you have to put a fence around the roof. And this is developed over the course of halacha to say we need to avoid all things that could be potentially dangerous. Okay, so as time goes on, I mean, there was a Cochrane review of the literature about all the benefits of breastfeeding, which was published in 2017, which really starts to talk about not breastfeeding as having potential health risks. Think of the opposite of all the benefits that you just talked about. And that already starts to put it into a halachic context of something that should be done. We also have the famous statement of the Rambam in Hilchot Deot when he talks about how doing things that are good for us and good for our health are one of the ways of worshiping Hashem. Okay, so it is important always to realize when we're talking about halacha that everything is case-based. But if we're talking in broad strokes, there definitely is a very positive halachic attitude doing things that are healthy. And as you pointed out so well, there's so many things we know today about how important breastfeeding is, not only for the health of the baby, but for the health of the mother. And that's how it fits together.
Right. Thank you. Okay. Now, breastfeeding is wonderful and beautiful, but just because it's natural doesn't mean it's not hard work. It doesn't mean it's not going to cost some money necessarily. So, breastfeeding education and support are needed before you even give birth. And the reasons are, firstly, these two factors are known to be one of the most significant factors in whether a mother goes on to actually breastfeed and whether she goes on to exclusively breastfeed her child. Now, hospital policies to promote breastfeeding affect how much support and education someone is going to get in the hospital in terms of breastfeeding. Unfortunately, not all hospitals are equal in their ability to provide breastfeeding support and education. And that's why it's important to have an informed approach even before going in, because it's impossible to fully know how supportive the hospital you're going to be in is going to be with the breastfeeding. If there's going to be staffing shortages and there's just not going to be enough people to help you, that's your bad luck. So it's important to come in with that informed approach to bridge these gaps. Now, why is it so important to have education about breastfeeding before birth? There's a lot of information that is important to know in the first few days of life. When you understand and have time to process the challenges beforehand, then you're going to have realistic expectations and you're going to decrease disappointment when you're faced with challenges because you're going to know, oh, I learned about this. This is normal. This can be a common problem and there are ways to remedy it. Now, giving birth also is very stressful. And in the immediate hours and days postpartum, there is so much else going on. The mother needs to recover from the birth. She may be exhausted. She may be in pain. She may be overwhelmed with her baby's needs at large and anxious about their baby's well-being, as is just so common for mothers to be. And all of these things are barriers to be able to fully and comprehensively learn and understand and get that education in those first few days. And some of this education is really extremely relevant to specifically those first few days, not toward the entire breastfeeding future course, but that can really make it or break it these first few days. Now, besides for the education, we want to set up a support system ahead of time. The first few weeks, as I said, are very overwhelming, the first few days especially. When you have a plan in place beforehand for accessing support that you might need, it's going to avoid extra stress because you know you have that reassurance that you have a game plan for if breastfeeding is going to be challenging, which I would say is there are more often challenges that come up than it goes completely smooth. There are some others that have it completely smooth, but I would say more often there are some kind of challenges. So once you know you have that support system to turn to fall back on that's already in place, it's going to be calming and reassuring for you, which is in and of itself extremely important when you're breastfeeding. We want you to be less stressed. Okay, and then we spoke about how different hospitals have different levels of support. So one thing you can do is you can actually research the hospital that you plan on giving birth in. And certain things that will tell you is the hospital baby friendly. In general, baby friendly means that the staff gets a lot more training about breastfeeding. They have many hours of training about helping to support mothers who are breastfeeding. Also, you can find out what kind of lactation support is there in the hospital. Are there certified lactation consultants that have a lot of extensive training? It's more than just a nurse or a doctor. And Dr. Zimmerman, you are an IBCLC, which is, I would say, the gold standard of certification for lactation consultants, because we know there are a few different kinds. So are there lactation consultants over the weekends? Because you may give birth over the weekend. Are there lactation consultants in the evenings or nights? These are all good things for you to find out beforehand in order to set up a good framework to make that breastfeeding successful. Now, also important is to find a pediatric provider that is breastfeeding friendly. Some pediatric providers are more supportive of breastfeeding than others. Some of them could just be a little parav, a little neutral, and say, if challenges come up, we'll just say, it's okay, give the baby some formula, or even recommend to mothers to give the baby formula, which is against the guidelines and practices that we have. So it's important to ask around and find a pediatric provider that is breastfeeding friendly, whether that's a pediatrician, a family doctor, or a physician's assistant, a nurse practitioner. Another good thing and important thing to do is compile a list of lactation consultants' names and numbers during pregnancy, even before you give birth. And the reason for that is because when you have problems breastfeeding in those first few days, it's like the world just is falling apart. And now you have to start making phone calls just to get names of lactation consultant when you can barely like even go to the bathroom and eat breakfast. And now just making one phone call feels like such an overwhelming task. And so like this, if you have a list, then again, you have that reassurance to fall back on, that you have a plan in place in case there are challenges that come up that you would need a lactation consultant. Also, if you establish contact and just make a call to one lactation consultant and say, hi, my name is Chanie. I'm 37 weeks pregnant. I am having my first baby and I don't know anything about breastfeeding, or I'm having my second baby and breastfeeding was really hard with the first baby. I just want to introduce myself and just find out, do you make home visits, et cetera, et cetera. Like this, you've established contact already. So if you need to call this a lactation consultant, you know them already, you've spoken to them already. And you can even just feel more comfortable calling and saying, hey, is this something that I need to be seen for? Okay. Now, also, not everybody gives birth in a hospital. Some people give birth in a birth center and some people give birth at home. And what that usually means in a birth center is that you're going home sooner than you would in a hospital. And at home, you are not going to have 24/7 round the clock people who are professionals who are trained in giving breastfeeding support. So it's especially important if you're going to be having a birth outside of a hospital to have the lactation consultant set up to make contact with them at least once so that you know you can have the help readily available. Ask your friends about lactation consultants they've used that they've been happy with. Ask if you're already using a pediatric provider for other children, then you can get that information from them too. Most pediatricians will work closely with a lactation consultant. Some pediatricians are actually lactation consultants. I actually work with a pediatric nurse practitioner in the hospital, and she is a lactation consultant, and that's all she does. She doesn't practice anymore in pediatrics. That's all she does. So find out from the pediatrician. Now, as well, different lactation consultants have different personalities. And as in any relationship, in any working relationship, different people will mesh better. So another good thing is just ask friends, maybe establish contact, call a lactation consultant. If they sound great, great. If something sounds a little bit off, you can try to make another phone call. Like this, you're not in, this hormonal mess, and then someone comes to your house that you just completely don't vibe with, and then it sets you off into another whole postpartum hormonal craziness. Okay, now another really important factor that we have through research that we know affects the success rate of breastfeeding is family support, societal support. It is a very, very significant factor. And some people come from a family where everyone's breastfed and they work hard toward it and they promote it and they encourage it. And that's a big priority for them. Other people may come from a family where their mother formula fed and their sisters and their sisters-in-law and their aunts and their grandmother are all formula fed or at least supplemented, and they don't see what the big deal is with formula. Just give the baby formula. If it's not working out, you have sore nipples, just give the baby formula. Now, if you are somebody that is really devoted and wants to breastfeed your baby exclusively, it's important to have good support. And if you know that your immediate circle is maybe not as supportive of breastfeeding, seek out those people, those friends, or other, people, contacts you may have. or the family members that you know are actually going to really be supportive, so that when problems arise, they're not going to say, just give the baby a bottle. What's the big deal? They're going to support you, and they're going to say, Mama Shefla, this is very hard, but you can get help. You can do it. You're not going to fall apart. You're going to give your baby what you need, what they need. Your nipples are not going to be sore forever, et cetera, et cetera. Okay. So, the family, the societal support is very important. And someone may come from a family where everybody's breastfed and, they're so into it, but then they marry somebody, a man who doesn't get what the big deal is. His mother formula fed him, everybody formula fed him. And we know that a partner's support is also extremely, an extremely important factor in how breastfeeding goes. All right. Are we good so far? Dr. Zimmerman, do you have anything to add until we talk about the early days of actually?
Yeah, it was interesting how you were talking about the mother staying calm. That too is a concept that comes up in halacha, because when they're talking about the laws of childbirth on Shabbat, one of the guiding principles there is the importance of keeping the mother calm, which I think is just a very interesting insight into how much Chazal, our sages, understood what women are going through during the course of childbirth.
Wow.
And I completely agree with you about the importance of being prepared, in advance, because many of the common challenges, as you call them, are preventable. Okay, not all, but preventable and mitigatable. So
yeah, and able to be remedied, and yes, with I should emphasize the stress and the calm, because the hormones are very synergistic, the oxytocin, the prolactin, everything. And babies we all know that anxiety is contagious from person to person, but even more so from mother to baby. So you really will do yourself a big favor if you have that support in place, so that you can decrease and, like you said, mitigate the chance that you'll be super anxious and stressed, which, let's be real, it happens to the best of us in the postpartum period. Okay, so now that you've prepared yourself, you have a good support system set up, what happens next is that you have the baby. And what's important after you have the baby is that early initiation of breastfeeding. The sooner you can get baby onto breast and feeding, the more likely it will be that the breastfeeding relationship will go well. And it affects numbers of mothers being able to breastfeed their babies exclusively and for longer periods of time. So the golden hour is the first hour, those first 60 minutes after birth. And it's called the golden hour because, well, firstly, the first hour of life is associated, again, with increased rates and duration. That means length of time, how eventually later on in life, how long you'll breastfeed the baby. The baby is most enthusiastic at that time. The baby's born, the world is so exciting. And when I talk about what the baby does, this is, again, very important to know this is generalized. Obviously, some babies come out not so awake. Maybe some babies come out needing resuscitation or whatnot. But I'm talking about the general rule, okay? The most common thing. So baby is most excited and most enthusiastic. And the mother's body receives the message to produce hormones to make milk, which helps establish good supply. The sooner you put the baby on, the sooner your body gets the message, hey, the placenta's out. Hey, oh, look, something is sucking on my nipples. That means I need to make milk. And it tells your brain, let's start making milk. After the first hour of life, typically, generally, babies tend to be super tired. It's hard being born, okay? So that first hour is also, you want to take advantage of it. You want to feed off of the momentum of that baby being so awake and happy and enthusiastic. Now, what are practical steps to encourage the baby to actually breastfeed in the first hour of life? So firstly, immediate uninterrupted skin to skin as soon as baby's born, if possible, which is possible in most cases. That means the baby comes out, the baby goes right on your chest, no hospital gown in between, no towel on your chest as we put the baby on, but put the babies on skin to skin, and baby can be dried off by the nurses or whoever. And all vital signs can be done while the baby's on you. All medications can be given while the baby's on you. I do footprints on babies, on their mothers. I really master the art of doing it upside down, because I can put the diaper on the baby when the baby's skin to skin on the mother with the tummy. So everything can be held off. You don't need to weigh the baby in that first 60 minutes of life. You can keep the baby on you skin to skin. And like I said, delay all the unnecessary procedures. Weighing, no. Bathing, definitely no, because the recommendations now are actually to delay bathing. If baby's healthy and fine and someone wants to take the baby out to give them medications or to do vitals, you can just ask in the hospital and say, oh, is my baby's safety at risk if the baby doesn't leave me? And if not, then there should be no reason for you to be separated from baby. Okay, so if the baby is reluctant to breastfeed, because again, kids are, all kids, they're on their own timeline. They want to do what they want to do. So what if your baby doesn't want to breastfeed? You did all the things. You did skin to skin. You delayed the cord clamping, which I didn't emphasize as much, but it's basically not cutting the cord right away. It's waiting at least 1 minute, if not longer, for all of that oxygen and iron-rich blood to pulsate and to get to the baby before cutting the cord. So you did all of that. You did all of the things. You did all of the rules. And baby's just still really not interested in breastfeeding. Obviously, keep on trying. Keep holding baby skin to skin and allowing baby to try. And you can actually manually express and ask the nursing staff to show you how to manually express milk right in that first hour, even if your baby is not latching on. And you will likely get some colostrum because your body starts making colostrum already. Even before you have the baby, there's colostrum in you. Some people will even leak colostrum before they have the baby. They're blessed. But you can manually express, ask the staff to help you manually express. It's not something that typically, in my experience, I've worked in 4 hospitals, it's not something that hospital staff will typically be like, oh, let's show you how to manually express. But this is the second best way to tell your body, hey, there's a baby, the baby's gonna need to eat, let's start making milk. And if you get anything, you can put it in a little spoon and a little medicine cup and feed it straight to the baby. Okay, now, in the case of a birth that is not your classic vaginal birth, such as a cesarean, it is possible to do many of these things too. Typically, you need extra staff on board to help out. So it never hurts to ask for all of these things. And if there's extra staff on hand, most likely they'll be happy to come in and help. It depends. As a nurse, I can tell you that it really depends on the day. So just daven that the day you'll come in, there will be extra staff on hand to do all of these things. Some hospitals, and I will say that more likely baby-friendly hospitals, they are the ones that actually put the extra effort into doing these things. For example, in a C-section, where skin to skin may be a little bit more challenging. The mother breastfeeding the baby in that first hour may be a little bit more challenging. Keeping the mom and the baby together may be a little bit more challenging, but baby-friendly hospitals typically tend more to do, to put the extra effort in to do these things. And I need to say that baby-friendly hospitals already have all of this in place. That's their standard policy. They do this all standard. Okay, now let's talk about rooming in. So sending a baby to the nursery comes with a price. I want to just ask you, Dr. Zimmerman, do we have captions that are being put out? Because I think we were supposed to have captions of the topics. They're not here, right?
I'm just going to put up what we want into the chat if we have links or stuff. In the meantime.
Perfect. Okay, so sending the baby to the nursery comes with a price. Breastfeeding is often not instinctual. Okay, it's learned, it's natural, but you still need to learn. You still need to work for it. When a mother and baby stay together, it enhances this process. Okay, because it's a dance between the mother and the baby. The mother needs to learn the baby's cues. The mother needs to learn what to do. She can continue to learn the baby's feeding cues as the baby stays with her. Every time the baby wakes up or starts to stir, she can start to figure out, oh, this is my baby telling me they want to eat, because babies can't speak English yet to tell us. So the mother learns the baby's feeding cues. Now, as well, interestingly enough, mothers also have less engorgement. Not interestingly enough, it makes a lot of sense, because when the baby starts to stir and the mother sees that the baby may be hungry, the mother's going to start to feed the baby and empty her breast. Versus if the mother sends the baby out to the nursery, then the baby stays out for a while. The mother's breast may fill up sooner, and she may have more engorgement. That will make it more difficult to, it's just more uncomfortable. It's going to make it more difficult to latch baby on, etc. Now, that being said, I do have a place in my heart and compassion for some mothers who really feel like they need the extra bit of help with their baby, and need to send the baby out to the nursery. Sometimes a mother has a medical condition and she may not be able to care for her baby independently, especially if she doesn't have the support of, a husband or a friend or a mother that's there with her in the hospital. If she just had a C-section, she can't move around. If she had some kind of medical complication, she may be on medicines that may make her groggy or dizzy or unable to get out of bed. So in a case like this is definitely a case where it would be safer to have the baby, in the nursery if need be, if she feels like she cannot safely meet her baby's needs. Now, sometimes also mothers will have a long labor and it may be complex. It may end up in a cesarean or whatnot. And I see sometimes mothers really try everything that they can to room in, and they really do a beautiful job. And at a certain point, they kind of just break and they just start sobbing. And I have Rahmanas on them, because they really try to do everything they can. And it's been like 3 days of being up 24/7, not sleeping, having a lot of stress on the body. So, I definitely think that for healing, there is a place to send the baby out if there is a nursery in the hospital. And I just need to say also, if there is a nursery in the hospital, people should know that it depends on staffing too. So just dive in that there should be enough staffing, because I work in a hospital with a nursery, but which is happening more often than not, when there's a lot going on, we close the nursery. So, some people actually, they're very into, I want to send my baby to the nursery, and they research and they specifically pick a hospital that has a nursery, which is the rates of hospitals having nurseries is decreasing. And they, only to come and find out, sorry, the nursery is closed tonight. We don't have enough staff to man it. So, even if you do send your baby out to the nursery, firstly, you can have the baby brought out to you to feed. Okay. Doesn't mean you need to give the baby formula. If the baby starts making signs that the baby's hungry, then ask the staff to bring the baby to you. Okay. As much as possible. Now, let's just cover quickly latch. Do not underestimate the importance of a good latch. Okay. If the baby does not have a good latch, it can cause so many issues, namely pain, which is not going to want you to breastfeed, because you're going to be in pain. And when I sit with a mother and help her latch the baby on, it's one of my favorite things. It's like a puzzle, actually, like just getting that good latch. And sometimes I'll come in, the mother's had the baby 12 hours ago, and no one's really shown her how to latch her baby correctly. And she's complaining of pain, and her nipples are starting to get cracked. And then I get that good latch, and she's like, you changed my life. Oh my gosh. I can't believe it. This feels so different. Latch is extremely, extremely important. Do not underestimate the importance of a good latch. So if you're having nipple pain when you're breastfeeding, you ask the staff to help you troubleshoot your latch. Okay. And I need to say that in most hospitals now, also staff really is obligated as part of their protocol to watch at least one full breastfeeding session that a mother is having. Okay. Doesn't always happen, but it is definitely a reasonable expectation to ask a nurse to do. Now, we want to also avoid artificial nipples because they can interfere with a good latch. It requires different coordination, different use of different muscles. It's a different shape. And it reduces the message to the mother's body to make milk. So the recommendation is to avoid artificial nipples until breastfeeding has been well established. And next, it's important to know the normal newborn feeding patterns, which you're going to learn when you stay in together with your baby as much as possible, right? Frequency. The baby needs to feed at least 8 times per day, but more typically it'll be 10 to 12 times per day, and it may be even more frequent, especially in the beginning. Supply and demand cycle. When a mother is breastfeeding a baby, when mothers breastfeed a baby who's hungry, it's a synergistic relationship, right? Supply and demand. So when you feed your baby, that's telling your brain, hey, there's a baby here that's hungry. Oh, let's release the hormones that we need in order to make more milk. And thereby the body starts to make more milk. So again, with the artificial nipples, that's one less time that your body's getting the message from baby that your body needs to make milk. Now, second night is called the cluster night, and it could be the second day, but typically the second 24 hours of a baby's life is called the cluster feed day. And this is so normal for people to know because so many times I have mothers that tell me, I don't have enough milk. My baby won't come off of me. I don't have enough milk. My baby's so hungry. And it's not that you don't have enough milk. This is a normal phenomenon. Okay, baby is starting to become more awake, starting to become more alert. Their tummy is very, very little, 5 to 7 milliliters, teensy tiny, like the size of a cherry when they're born. And now it's starting to grow. And remember, we talked about the supply and demand. So now supply and demand, they're saying, I'm hungry, make more milk, make more milk. And the more you feed them, the sooner your milk will come in and in greater quantities. So this is normal. And if you know this ahead of time, it will make you believe in yourself that you can make milk because we know 97% of mothers are able to make milk. The 3% for different reasons, such as medical reasons, cannot. So this is normal. And it doesn't mean that you don't have enough milk. Again, one of the big reasons why people quit breastfeeding or quit exclusive breastfeeding is because of the belief that they're not making enough milk, that they're not able to meet their baby's nutritional needs and make enough milk. Now, how do we know if a baby is getting enough? Weight loss of up to 10% is normal. Every baby is going to lose weight after birth. Majority of babies, up to 10% is normal. However, we can start to reach a point where it's 9-10%, and the staff is starting to get a little bit concerned about what's that the baby's losing too much weight. Do we truly have enough for the baby? Does the baby have higher demand? Wet and dirty diapers, okay? And I like to say as many days of life, that's the minimum amount of wet diapers. So day 1, we want at least 1 diaper in the first 24 hours, at least 2, etc., until day 8. And then it kind of stabilizes. We want at least 8 wet diapers. By day 8, at least 8 wet diapers per day for the baby. And then staff will show you other signs. Like I said, there's latch. They can show you what a swallow sound sounds like, and they can show you baby's appearance and behaviors to signify that the baby is getting enough. So again, with proper support and information, 97% of mothers can produce enough milk. The most common reason for formula supplementation is because, and I said this, a mother believes that she cannot produce enough milk. Cluster feed night is normal. You can produce enough milk. It will not last forever. I cannot emphasize this enough because that second night, the mother's just like, they're just so frustrated. That whole high of giving birth is kind of petering down a little bit, and it's normal. Will not last forever. Now, Dr. Zimmerman, we're going to come back to you because what happens if the staff is truly concerned about the baby's intake, and they may start to tell the mother, we need to start to get you to pump, okay? Or manually express extra milk for the baby. Let's give your body even more messages to make milk. What happens if it's Friday at 7 p.m. that this is determined and the staff tells the mother that she needs to pump or manual express on Shabbos? So what does halacha say about this?
Okay. Before I start talking about the halachas of Shabbos, a question came in from our audience, which ties in a little bit to what you were saying before about sometimes there being staffing problems. And they asked the question from the point of view of Hilchot Nida, can a woman ask her husband for help? And I think one of the things that we need to realize is from a halachic point of view, in the first week after a woman gives birth, she is considered in the status of a choleh sheyesh bo sakana, of somebody, even if it's a perfectly normal, healthy birth, this is a very important physiological time of life. Things can happen, and therefore we have to take care of her needs. And therefore, when we're talking about halacha, and this will be true in the pumping and the fasting and all the topics we're going to talk about, it's always a matter of balancing one halachic principle against the other halachic principle. So yes, a woman after she has given birth is in the same status of a nida. And if there are other people around who can hand things to her, that would be better. But there's no question, if there's a staffing issue, she's there by herself, the only person with her is her husband, then he can do the things that she needs. Attempts to be made not to touch directly. Okay, so if you're handing the baby to the mother, hand it so you're like holding it on the baby's blanket and things like that. So the dad certainly can help that.
I just want to, just one more thing with that is important to know from a nurse's perspective, and I hear nurses say this, it's a little bit, nurses have resentment when they get called in just so that they can take the baby out of the crib to give it to the mother as well. I'm not saying what the right or not right thing to do is. I'm just saying that needs to be kind of a consideration. If the nurse is with you in the room, it's different. But if you're calling the nurse in specifically just to do that, and she's in the middle of dealing with a patient who's in immense pain, and she has to leave that patient to take the baby out of the crib to give to you, again, everything in context, but it's good to keep that in mind as well.
Okay, so getting back to the pumping question that you asked, and remembering now we're talking about a woman right after birth. So the halachic principles that we have to keep in mind as far as pumping is that the actual action of pumping is a Torah level prohibition on Shabbat. Okay, and that's even if it's done without electricity. It's actually the removing milk using technology, because obviously breastfeeding directly is no problems on Shabbos, so is an issue that has to be taken into consideration. Now, the Torah level prohibition is taking the milk, putting it into a vessel, and feeding it to the baby. So if the reason that the mother is pumping is because she's engorged, okay, and for some reason she wouldn't be giving the milk to the baby, that's not a problem, okay? And she can definitely do that. That's straightforward. Already they talk about it in the Shulchan Aruch about the importance about letting a mother remove milk from her breast if she needs to. The questions come up more, and that would be the same thing as well if she was pumping and nothing was coming out and she's just doing it for the extra stimulation, okay? So that is not as much of a problem. The issue comes in when we're actually feeding the milk to the baby, okay? Because I said that's the Torah prohibition. But remember, you're talking about a situation in the hospital where we're in the first week of life. Okay, and therefore the needs of the baby for this milk, the dangers to the baby, especially in these first days after life, being exposed to formula, because the baby's gut cells are very open at this point, and things can get into the system and prime the body to recognize these foreign proteins in a different way. And therefore, I would say in the situation that you're talking about now in the hospital, definitely, she should hand express, okay, even though it doesn't matter with the electricity, as I said, but the issue of the pikuach nefesh, also of the mother, also of the baby, would overweigh the halachic considerations of breastfeeding, of pumping that I talked about. Now, the issue of pumping on Shabbos could be an entire, hour talk. And we're going to put in the chat a podcast that was already done on the halachic issues of pumping specifically. And I'll just end a question that because it's a matter of balancing issues, halachic issues, then it depends a lot on the age of the baby. What I just said about the newborn is not necessarily going to be the same answer if a woman is asking a question about, a 1-year-old who's also eating food and things of the sort. So that, I think, also illustrates what I said at the beginning, that halacha is very much a case-based kind of situation. So we're kind of in this talk outlining halachic principles and ideas, but when you're coming to an actual situation, ask the question. But I hope by giving you, the background, women know that they should ask the question and that it's important and that they should get it. Someone asked also, just one last word about the pumping, about what if she is, going back to work, okay, and she's having supply issues. And that's, a lot of those issues were discussed in the podcast that you see on your chat. So I won't go into that into too much detail, but I think we talked about what the background halachic issues are specifically.
Thank you. And I just want to add in that NICU babies and premature babies, we know even more so with formula that it can actually cause real bacterial infection, and that how breast milk is so vital. So, and I work at a hospital that we have human donor milk. That's how important it's been shown, that they really try to actually avoid, even in term babies, if a mother needs to supplement for medical reasons, then if she's otherwise breastfeeding, they'll give human donor milk. So just to, again, reinforce what you said.
Right. And in the case like of a preemie baby, that would be another example of the individual circumstances changing it, because if a premature baby remains in the status of a chole sheyesh bo sakana, of somebody whose life is in danger, and as long as he remains in that situation, then obviously, the breast milk is part of it. I mean, it's one of the things, the bacterial infection that he was talking about is usually necrotizing enterocolitis, and human milk has been shown to be one of the major factors in avoiding it, reducing the risk by like 58%. So,
yeah, it's like medicine, really. It's like medicine. So, okay. Now let's start to talk about fasting and breastfeeding, okay? Because like you said, you covered the whole Shabbos thing in another video that people can, will send the link to. You can listen to that in depth. But fasting, I think, is very interesting because there's not really a lot spoken about it. So I think in pregnancy, we speak about it more, but I think that it's not given enough attention during lactation.
Okay, so it's certainly a very frequent question that gets asked to the Yoetzet Halacha on the website. I said at the beginning that I'm a Yoetzet Halacha, and one of my jobs is running the Nishmat Women's Health and Halacha website, yoetzot.org. And every Yom Kippur, every fast, we're getting these questions coming on. So yes, it definitely is a question. And I think to understand that question, the halacha principles that we have to realize is that there are different levels of fasts. Okay, we have Yom Kippur, which is a Torah level fast. We have Tish'a, which is on a rabbinic level, but a very serious rabbinic level, almost as close to Torah level as can be. And then we have other fasts such as Atara B'Teves and Tzom Gedalia, which are at a lower level. So from a straightforward halachic point of view, I'll call them the 4 fasts. Women who are pregnant or breastfeeding do not have to fast on those. And I would recommend that they not try to be extrally brave and fast on them, because when you're balancing, if there's no halachic obligations, most of the times women can fast while breastfeeding without issues. but why ask for trouble if there's no reason to do so? Okay?
And putting
On
your
the
health
other
at risk.
hand, I'm sorry?
And putting your health and your baby's health at risk, potentially.
Right. Most of the time it's okay, but maybe this will be the one time that you'll have a challenge. So why do it if there's no reason to do it? When we're talking about Yom Kippur and Tish'a B'Av, all right, the halacha assumes that most healthy pregnant women can fast on these fasts. But it's important, now I'm switching for a second to the medical point of view. It's important that the mother prepare. And I know, Chanie, you prepared a whole list of hints to it, which you'll get back to, in a minute. We're also going to put your fasting plan link to it on the chat so people can see it in detail. But I think, most women can, in fact, do what Chazal assumed, because when they may never had the medical knowledge we have today, they had a lot of life experience, okay? And most women, in fact, do manage to do these fasts, okay? But it depends also where you are in the childbirth process, okay? A woman who has just given birth, from a halachic point of view, in the first 3 days after life, is not supposed to fast, halachically, okay? She's a choleh sheyesh ba sakana, and she is not allowed to fast. From day 4 to 7, she's almost in the same category, that if she says, I can't fast, we listen to her. And I would recommend that in that period of time, because we're still establishing breastfeeding, she should not go out of her way, to fast even on Yom Kippur. When a woman has, not only a woman, a man has a medical reason not for fasting on Yom Kippur, one of the things that is recommended is shiurim, small amounts. Because in order to reach the top level of prohibition on Yom Kippur, one has to eat at least a minimal amount or drink a minimal amount. And if one doesn't reach that minimal amount, then what one is doing is less of a prohibition. Okay, so when we're saying that something is permitted on Shabbat or something is permitted on a fast, we do try to minimize it what we can if possible. So that's the idea behind shiurim. Of the eating and drinking for breastfeeding women, the drinking is more important. So she can put the emphasis on drinking small amounts frequently. What the exact small amount is and how frequently, there are a couple of different halachic opinions, so that's worth checking up closer to Yom Kippur if it's a relevant situation. Once one is drinking, it doesn't just have to be water. So one can drink something that has a little bit of caloric value to it, like an apple juice, a clear broth, things like that. And that's the way that one can get through Yom Kippur without it impacting on either the health of the mother or the health of the baby. If the fast that comes out at a time that a mother needs to eat is Tish'a B'Av, this idea of shiurim is not part of Tish'a B'Av, so either she's fasting or she's not fasting. Obviously, one should be keeping the spirit of the day, and this is not the time to sit down and eat, that gourmet meal that you're always dreaming about, but that you're eating or you're drinking for the purposes of yourself and the baby. The more challenging kind of situations come up in the case of mothers who have had issues in their breastfeeding, okay? She's already in the second, third week. Most mothers, by, let's say, the second month, all right, most mothers are ready, their breastfeeding's established, things are going well, and the fast is not going to be the thing that's going to make the difference, but there are exceptions, okay? The woman who had a lot of trouble at the beginning may still be struggling at that time, and therefore the answer she needs to be given about fasting on Yom Kippur or Tish'a B'Av is different than somebody else. And that really goes back again to the importance of individually asked questions.
How an individual situation affects the decisions regarding how halacha is interpreted.
Right, and that's true in all areas of halacha. It's true here as well. I think what's most important for women to know is ask the question, and when you're asking the question, make sure that all your individual details are in that question. Because if you ask the halachic authority the question, do pregnant women or breastfeeding women fast on Yom Kippur? So the straightforward answer is yes. But that exact same Rav, Yoetzet, whatever, if you say here, listen, I'm sitting here pumping an extra 3 times a day because I'm not making enough milk. I'm really worried that if I fast on this, it's going to be the end of my nursing. You're going to get a different answer, okay? Because you're asking the correct question. So I think it's really important to always ask the same question. And it's not only, and I'll say that about Yom Kippur, and I'll say that also about the, pumping on Shabbos kind of issue, because somebody sent in a question here having about like going back to work and pumping to keep up your supply and what you can do on Shabbos and things like that. So very often when it's a matter of keeping up your supply on Shabbos, the fact that you're with your baby over Shabbos and nursing, all right, is probably the best things that you can do to keep up your supply. But in situations, whatever the baby's not latching, if it is understood what the issue is and what the price is, etc., one's going to get a different answer than just asking the same question. And I'll just touch on one last question that came in, through the chat that ties in what you said before. Taking the nurse into consideration when calling the baby, the idea is not to leave the mother there suffering. Okay, really remember that the mom is a really important thing here. She's important from a halachic point of view also, and you're not supposed to leave her suffering, and that's part of the halachic considerations as well.
That's brilliant, which is common for a mother to have to wait in the hospital. Nurse is not going to be able to always run in right away. Thank you for that. So we're running short on time. I'm just going to quickly gloss over the fasting plan because there should be a link, I think, to it. Is it going to be linked here?
It's supposed to be put up as a link on there. Yeah.
It's a PDF, but basically, like Dr. Zimmerman said, hydration is so important, more important than any of the other things. And you can't start hydrating the day before as an afterthought, okay? You have to start storing up, you have to start building up stores a few days in advance. And you already have high hydration needs as a breastfeeding mother. So you're going to have to hydrate even more on top of that, okay? And the details of hydration is going to be there. Secondly, decreasing activity as much as possible so that you conserve your energy, which means with the children, other children, you want to make sure you have a plan with them, which means not going to shul if you're afraid that you may compromise your fasting, because on Yom Kippur, fasting is the priority. That also means that if you need your husband's help, do not feel bad, because again, the priority is fasting. And then staying in a cool environment, that's part of the decreasing activity. That's also going to help you with not getting dehydrated. And milk supply, super important. It's probably going to decrease the day after the fast when you've depleted all of your stores that you have already in you. And that's okay. You're not going to damage your supply permanently. For the next 2 days, hydrate, replenish with drinking a lot, and breastfeed very frequently. And again, we spoke at the supply and demand. So this is what is going to allow your body to get back to its supply. So it might be a temporary dip in your supply, but it's not going to be permanent if you continue to do all these things. And of course, like you said, discuss with the Rav, because every situation is different. Discuss what threshold at which you'll see that it's time to break your fast. And any other personal medical conditions and situations that you have. And then shiurim, of course, like Dr. Zimmerman said, there are different opinions. So speak to your personal Rav about their opinion, when you should start and how frequent, and the amounts. So let's just duration of breastfeeding, right? Let's cover that topic about what the Torah's view is on duration of breastfeeding. Okay, because all the authorities, the World Health Organization, the American Academy of Pediatrics, say at least 6 months of exclusive breastfeeding, preferably. And then the World Health Organization, which is kind of known as the authority, says 2 years. The American Academy of Pediatrics says 1 year, but will probably end up changing over to 2 years as well of breastfeeding. And they recommend that as the healthy thing. So Dr. Zimmerman, what can you tell us about halacha and duration of breastfeeding and just the Torah view?
Okay, so first of all, I just want to give a little bit anthropological background to these lengths of breastfeeding, because someone in the audience might be saying like, what? But in fact, the recommendations of all organizations are exclusive breastfeeding about 6 months of age, with continued breastfeeding, obviously along with food, healthy food, preferably food that's culturally appropriate for the families, for the family's diet. And the only difference between the two opinions has to do with what the minimum is. So the AAP's minimum is a year. The World Health Organization's minimum is 2 years. I'll point out the Canadian Pediatric Association has already gone over to 2 years. So it's not only, developing countries versus not developing countries. So Canada does recommend a minimum of 2 years, but they all agree as long as the mother and child desire. Okay, so these are minimums, not maximums. There was an anthropologist by the name of Dr. Catherine Detweiler who tried to figure out what is the natural amount of time for breastfeeding in humans, because there's so much cultural overlays now. The fact that many people breastfeed less. Well, what was the body meant to do? So she did it in a couple of ways. First of all, she went to look at more traditional societies that have less cultural overlays. And in those societies, the length of breastfeeding is usually from about 2 to 4 years. And she also tried to compare humans with other primates, either based on the length of their pregnancy or based on the length of when they double their birth, when they reach their birth weight, when they reach a third of their adult weight. And she did all kinds of calculations and came out from that also the amount of time is somewhere from about 2 to 5 years. And if we look at what Chazal talk about, Chazal are assuming that breastfeeding is at least 2 years. Okay, we see these in a number of halachot. One of the halachot is Chazal were concerned about the needs of the baby for the breastfeeding, and the person who would be breastfeeding is the child's mother. So in the unfortunate situation where somebody, was widows or divorced and wanted to remarry, there is a halachic issue about not remarrying within that 2-year period, so for the needs of the baby. I will mention that, once again, case-based situations, and that's not always the bottom line that is given in real situations in today's day and age, but it does show that the amount of time that Chazal assumes is breastfeeding is 2 years. You can also notice that Rashi talks about 24 months, because when we have this scene in Breshit where Avraham is making a party because Yitzchak has been weaned, you look down at the bottom of Rashi and he's going to say 24 months, okay? Because that was obviously the amount of breastfeeding. Halacha also does have a maximum age, all right? At a certain point, it is assumed that children are not nursing from the breast anymore. And this actually has to do with halachot of kashrut. It does not have to do with modesty, okay? The maximum age in halacha is 4 to 5, okay? 4 in a healthy baby, 5 in a less healthy baby, though this is not like a pikuach nefesh kind of situation. This is basically a child who still wants it can continue in getting it up to age 5. And therefore, from a Torah point of view, we have a duration of breastfeeding from 2 to 5 years. And I just find it fascinating how that fits in, to the anthropological data that I talked about, and also to the recommendations that are now being given by the the organizations in terms of the duration of breastfeeding. So I see we've come to the end of the talk. There is one question here about, if you're nursing behind 12 months, are the halachic considerations for things like fast the same? The importance of the breastfeeding is still true. However, usually by the time a mother is also giving the child food, the baby does not need the milk that she would express on Shabbos or suffer that to the same degree, okay? Moms can go away to conferences for 2 to 3 days at that age, which is why extended breastfeeding is not the same experience of newborn breastfeeding. It's not like 10 times a day until they're 5. So most of the time one, would fast at that age. One could pump if the mother's engorged or you want to prevent mastitis, but we wouldn't be giving the milk to the baby. But as I stressed so many times, specific situations.
Yep. All boils down to specifics. So I think we're coming to a close, and we didn't really get to discuss the modesty piece, which we wanted to. I don't know if you can tell it to us in 2 minutes, but
okay, so basically, as I said before, first of all, Chazal do not have a problem with a 3-year-old or a 4-year-old breastfeeding. Breastfeeding is a natural kind of thing. This is within the time that babies can breastfeed, and it's not considered an issue of tzniut. And also within the confines of the house, all right, there's a famous Ben Ish Chai which talks about how the husband does not have to leave the room if his wife is breastfeeding, okay? He can go around his regular business. He shouldn't be sitting there like staring at her, but he doesn't have to do it, and she doesn't need to cover up within her house, around
even
her
during Nida.
husband. Even during Nida. Yes.
It's very important to know. Mm-hmm.
Right. Okay. And I think it's important in terms of just making this easy for mothers, and that mothers don't have to always be running into another room. In terms of, when other people are in the house, then there is a little bit more of modesty, but it's not the breastfeeding that is an issue. And mothers very often learn quickly how one can nurse incredibly modesty to the point that no one even knows practically what they're doing. One can stay in the room, slightly turn their back. They have, so that's already a matter of cultural comfort, how to be able to do it. But mothers should not feel that they're doing something shameful in breastfeeding. It's totally the opposite. They're doing something, wonderful, and something that's very much looked on favorably for halacha. And we as a society and a community should be trying to make this as easy for moms and as pleasant for them as possible.
Yep. Thank you so much.
Thank you.
And it was great doing this. I learned so much.
Good. Okay.